everyone, welcome to our channel. By the names I'm called Wefafa Andrew. If it is your first time, consider subscribing by clicking the subscription button below, and you will be part of this show such that you don't miss any update on coronavirus as far as Uganda is concerned. Now in this video, I just want to talk about some of the few important things. Remember, I just want to share only the true information about coronavirus. I know a lot has been said, we have heard a lot, we have seen a lot, but what is really correct about coronavirus? That is what I'm just going to share in this video. I'm going to give you the background, definition, signs and symptoms, how to diagnose or how to test for it, and then prevention. Now, COVID-19 is a disease which affects our system, which helps us to breathe in and out, also known as the respiratory tract. It is a disease which was discovered by a Chinese doctor called Dr. Li, who died. COVID-19 is caused by SARS-CoV-2 or Severe Acute Respiratory Syndrome Coronavirus 2 because it is genetically similar to SARS-CoV-1, which caused an outbreak in China and Canada in 2002 to 2003. Now, what are the signs and symptoms of COVID-19 or coronavirus disease discovered in 2019? A patient may have fever or increased body temperature. A patient may cough. You see, a person may cough. Then, a person may also present with difficulties in breathing. But also, it can go as far as beyond those three signs. And a person may present actually with shock, whereby he will have very cold extremities, will be sweating seriously, and will be with a very weak pulse. Also, a person may present with other signs of pneumonia. Now, who is at risk of developing this disease? As we talk, everyone is at risk, but there are some people who are at a higher risk. The older people at a higher risk. People who are above 50 years, they're at a very high risk. And then people who have other conditions, like people with weak immunity, like people of diabetes, people of sickle cell, people of HIV/AIDS. Those ones, they are all at a higher risk. Now, I want also to talk about the prevention. How can we actually prevent this disease? Now, this disease can be prevented when we are very careful with our hygiene. So, as I mentioned, this disease mostly enters our body through our respiratory tract system. So, 1, you are encouraged to wash your hands with soap and water. 2, you are also encouraged to avoid touching your eyes, nose, and mouth. In other words, avoid this T-zone. The T-zone should not be touched. Also, avoid shaking hands anyhow. You can use a jumbo, you can just say hi, or you can use your elbows when you're greeting someone. Also, you are advised to avoid overcrowded places where people are too many. Another advice is you should at least keep 6 feet or 2 meters away from someone who is coughing, because the good thing with this COVID-19, this virus, it does not survive in air for a long time. Like, it cannot move a very long distance in air. So when you keep a distance of at least 6 feet or 2 meters away from someone, you cannot be able to acquire it. Okay, another thing, you can also prevent yourself from getting COVID-19 by avoiding traveling to areas where they suspect that condition to be. For example, in Kenya, as we talk, in Uganda, we have not reported any case. But if you're in Uganda, avoid traveling to Kenya because they have confirmed cases in Kenya. Now, if you are a health worker, you can also protect yourself from getting this virus by washing your hands, using those sanitizers. We have alcohol in most of the hospitals. You can use that one. And also, you can avail yourself with a mask, an N95 respirator mask. This one will help to prevent those particles from entering you. For example, of course, you have to talk to a patient, but they cough. Advise them to look aside and to use a tissue. And after that, let them discard it. Now, if you found this video important, please consider subscribing to my channel, like the video, share this video with other people such that you can save a life. May God bless you, for God and my country.